Hello everyone, it's me Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today, the topic of my discussion is seborrheic dermatitis. Hopefully, you will learn and subscribe my YouTube channel. Definition: it is a common relapsing dermatitis characterized by erythematous patches with superficial scaling affecting seborrheic areas of body, for example, scalp, face, central chest, and anogenital area. It is caused by lipophilic yeast species, namely Malassezia. The Malassezia species was previously known as the Pityrosporum species. The pathogenic mechanism of seborrheic dermatitis is indirect and via immunological mechanism. Epidemiology: it affects 1 to 3% of population. Dandruff has been associated in 50% of cases. It's a common in male about 20 years of age. The peak prevalence is about 30 years of age in men. The prevalence is higher in patients with HIV positive infection. It has been observed that 17% to 83% of patients with HIV positive have seborrheic dermatitis. It is also associated with human T cell leukemia virus infection. It has also been observed that there is twofold increased chance of having seborrheic dermatitis in human T cell leukemia virus infection. The prevalence is higher in neurological disease as well, for example, Parkinson's disease. It's the commonest form of eczema in Korean patients with spinal cord injury. Pathophysiology: the Malassezia species, especially Malassezia globosa and Malassezia restricta, are commonly associated. Increased secretion of lipases and phospholipase leads to formation of oleic acid, which impair epidermal barrier function, causing desquamation of skin as a dandruff in susceptible individual. Other mechanism is the production of immunoregulatory metabolite and oxidative stress that contributes to its pathogenesis. Ultrastructural study shows depleted and disorganized stratum corneum lipid. Clinical features: it is usually observed in early adult life with localized inflammation and superficial flaking or scaling of skin. They may be asymptomatic or itchy. It typically runs as a chronic relapsing course. Seborrheic dermatitis affects cutaneous fold, for example, nasolabial, ear creases, eyelid, gabular area, and medial eyebrow. Scalp involvement is characterized by mild flaking or scaling without underlying erythema to more inflammatory eruption, with thicker yellow greasy scale and crust similar to similar changes are also seen in the beard area. Anterior blepharitis leads ultimately to conjunctivitis. Clinical variant of seborrheic dermatitis. Infantile seborrheic dermatitis presents with cradle cap and napkin dermatitis. It usually appears at 3 months and disappear spontaneously by 8 months of age. It often involves eyebrow, paranasal, and large flexus area. In adult, seborrheic dermatitis is associated with common dermatosis with predilation for sebaceous area, including acne, rosacea, pityriasis versicolor, and Pityrosporum folliculitis. Widespread seborrheic dermatitis may rarely evolve into exfoliative dermatitis with erythema. This picture describes the appearance of scaling in scalp area. This is due to seborrheic dermatitis. The appearance of scale is usually due to involvement of sebaceous gland. In picture B, you can see the appearance of scale has also been noted on the back of neck area and on the ear behind. This is the example of seborrheic dermatitis. Here involved area is forehead and medial eyebrow. These are the area where high sebaceous gland are noted. In picture B, you can see the involvement of cheeks area and anterior surface of neck. Seborrheic dermatitis is also observed in anterior surface of chest area. You can see in picture A. In picture B, the nasolabial fold area is involved. Differential diagnosis. Differential diagnoses are psoriasis, allergic contact dermatitis, diarrhea disease, Halle disease, pemphigus foliaceus and erythematous, pityriasis rosacea and erythrasma. In infant, differentials are histiocytosis, zinc deficiency, acrodermatitis enteropathica and linear disease. Drug involved: captopril, D-penicillamine, gold, sodium thiomalate, lithium, methyl dopa are involved. Other drugs are chlorpromazine and cimetidine. The most frequent drugs involved are interferon alpha and ribavirin. It also occurs as a side effect of erlotinib, sorafenib, sonitinib, and vemurafenib. Complication and comorbidities and prognosis. It is the most common HIV-associated dermatosis occur early in the course of disease. It may be acted as initial marker for HIV infection. Stressful event, anxiety, depression, anorexia nervosa are the important association. Other associations are cancer, alcohol consumption, old age, usually above 65 years, and loss of self-sufficiency. Recent associations are hypertension, higher body weight. It is chronic complaint. Patients usually require long-term treatment. Thank you very much. Stay connected and subscribe my YouTube channel.